Hello, everybody. I hope you can listen to me well. Welcome to we'll be starting the webinar right now. Okay. Welcome to the Multipurpose Cash Outcome Indicators Lunch and Learning webinar. This is a very good opportunity to be able to, in fact, to disseminate and explain better about the MPC Outcome Indicators document under the Grand Bargain Cash Workstream that was released in July 2019, as well as listening to some different experiences from the field of organizations that are using it already and piloting them. Based on all that, and counting on you all, in fact, as a participants, we want to engage in further discussions related to the use of these MPCA outcome indicators, how to use them, what are the early results, what are the challenges so far, right? The webinar will be, as you can see, will be recorded, so it will be accessible to people that were interested in the topic and in the webinar and couldn't attend. Or to you also, if you want to repeat the experience. Well, let's move to the agenda will be, the agenda of the webinar is the following. First, we will start with a brief background on the MPCA outcome indicators. Then we will provide a quick feedback about the survey results on indicator use to date. This is a survey launched just previously to this webinar to get a broader set of feedback and opinions. After we will have two field presentations about the MPCA outcome indicator use or piloting. First one by Emily Arnaud, representing the CCD Colombia, and the second one by Kunder Katak, representing Save the Children Peru. Finally, of course, we will have some time for the Q&A, additional feedback from other participants in the webinar, and open discussion in general. Okay. Before beginning with the first point of the agenda, I would like to present ourselves as a co-facilitator. I would like to indicate that the MPC Outcome Indicators Initiative is being co-led by CRS, USAID, and CaLP. And we are today co-facilitating this webinar, Dina Brick, Senior Technical Advisor Food Security and Markets at CRS, Laura Meisner, Economic Recovery Technical Advisor at USAID, and myself, Jose Joda, Senior Technical Officer at CaLP. With this, I hand over to Laura for the first point of the agenda. Good. Yeah.
Everyone can hear me, yes?
Yeah, good. We can hear you.
Okay, wonderful. Thank you. Thank you, Jose, for that introduction, and thank you to everyone who's joined us this morning or this afternoon, depending on where you are. So I will be presenting a brief update of the indicators, and if you are not familiar with the indicators themselves yet, I would encourage you to go to the link below on the screen. That's tinyurl.com/MPC indicators, and that can perhaps help you follow along. Next slide, please.
Yeah.
So the goal, this came out of the Grand Bargain Cash Workstream back when that was first launched a couple of years ago. And the goal was really to try and see if we could harmonize as much as we could, and as much as it made sense to do so, among donors and humanitarian implementers, how we measure the outcomes of multipurpose cash. This came about because largely there was divergence. There wasn't really a particular consensus. It also tied in with some of the other Grand Bargain commitments, such as around reducing the reporting burden. So we thought, if we're going to work together on these, then let's at least try to have them harmonized so that we are not unduly burdening our partners with reporting. And then also just to learn, because at the time, really, it was either focused on sort of food security as Multipurpose Cash had largely come out of the food security response, as we all know, or it was very holistic, but there wasn't a lot of coalescing around what made sense. So we decided to start on a process that took us over a year and a half. Could you move to the next slide?
Yeah.
So back in very early 2018, we put out a wide call for really just any outcome indicators that people were using or had used or were considering using for Multipurpose Cash. We got close to 100 submissions. We did some analysis of this and then put out for participation to the Grand Bargain Cash Workstream for agencies who would like to be part of a broader group. In the second half of 2018, we formed a reference group with around a dozen different agencies, both NGOs and UN agencies and donors as well. Over the next sort of 5 to 6 months or so, we went through several rounds of drafts. We reached out to cash and markets focal points in various clusters, and we held several remote meetings so that we could come up with the consultation draft, which is what we launched in March of this year. That was for wide open public comment, and additionally spurred on by a group of donors led by ECHO, who had sort of called and said that they would be very interested if everybody could come together and have shared indicators, that they might be interested in adopting them as well. So in April and May of this year, we made additional edits. We presented the almost final draft at the Grand Bargain Cash meeting earlier this year in Rome. And in July, we released a final draft for testing. What we are doing now since July is there are agencies using the indicators and testing them out, which is part of what we're sharing with you today. We'll have 2 different speakers presenting their experiences and successes and challenges and some opportunities for learning and improvement. And then in the lead up to next year's Grand Bargain Cash Workstream meeting, we will be doing additional reflection on the quality and the usefulness of the indicators and how to improve them. So we also launched a survey a couple of weeks ago, and Jose will also be sharing the overall results of that too. But first, let me delve a little bit more into what the indicators are. Next slide. So we have sort of 2 sets of indicators. One is the cross-cutting and holistic ones. So these do not attempt to be focused on a sector. They are heavily focused on people's own experiences and people's own preferences. One of them is a required indicator on roughly how much of households' basic needs were met according to their according to their own priorities. There's one required process indicator, which is very close to the draft ECHO protection mainstreaming indicator about whether people were able to access their assistance in a safe and inclusive and dignified manner. There's an optional indicator on gendered use of cash and equity in terms of having a say in the use of the cash. There are several qualitative questions to get at people's own perspectives about how the money was used, or rather not how it was used, but on what the major changes they saw in their life were because of it, and then what changes or things are important but that have not yet been achieved because of it, so that we can get a sense for what hasn't happened yet due to cash. And then there's additionally the livelihoods coping strategies indicator index, which is optional. Next slide. Then we get into the sectoral ones. We made a decision, again, balancing that tension between wanting to capture what was important, but also have some flexibility and also have some sectoral grounding so that we could improve coordination and conversations between cash folks and the sectoral folks, especially at response level. So based upon the MEB, what was in the transfer value, and what people's priorities were coming up in needs assessments, it was required to have at least 3 sectoral indicators. So among them, food security, shelter and FI indicators, WASH, health, child protection, or education. And then for those who wish to track expenditures and compare them to the MEB, there are also optional indicators around that. Next slide. some of the things that we really have grappled with throughout this process, and we still are, and we're still learning. One of them is about household level indicators. So these are some of the indicators that came up during the proposal and generation stages of this initiative were focused on individuals. For example, seeing how the transfer differentially affected men and women or boys and girls within the household. However, as a way of making it a little bit more manageable for monitoring staff, we decided to focus on only household level indicators, and even then largely on household surveys. So most of this is going to be self-reported, and I think some of our speakers are going to get into that a little bit. There are a couple where it's encouraged to complement it with other objective measurements, and there are some that are a little bit more rigorous, but a lot of it is self-reported by households. We have some newer indicators in there, such as the Livelihood Coping Strategies Index, which don't have a lot of wide use yet, although they're starting to grow. So some of the indicators in there are very, tried and true, such as RCSI or food consumption score. Others are fairly straightforward and not dissimilar to what other agencies have been using, but some of them are a little bit newer. So, we're learning, and of course we had to make that tension because we, if we're going to put something out and say that this is the consensus, and we want to be honest about the fact that perhaps we're still learning. Additionally, as you've seen with the previous two slides, we have this balance and this healthy tension between focusing more on holistic aspects, measuring basic needs overall, focusing on people's well-being, looking at people's own perspectives and priorities about what to do with the cash, versus trying to have some more sectoral focus, looking at, what are the sectoral needs, why donors might have decided to provide multi-purpose cash, and trying to have some sense of getting useful data back that helps us be able to make decisions about how to proceed in a response. Even though they are called the outcome indicators, you will notice that there is one process indicator, as I said, about the protection mainstreaming. There was just overall very strong interest and support for this at the Grand Bargain Cash meeting in Rome, and it was decided let's not have an entire other separate process or document for this if the outcome indicators document is the one gaining some traction, so let's put it in there. Additionally, there is a bit of a trade-off. Evaluations of multi-purpose cash could go really quite broad. It can do a lot of things that we never expected it to do, some of those positive, some of those negative. However, again, in the interest of providing something that would be manageable for monitoring staff on the ground, we wanted to keep a fairly narrow focus on the core intended objectives of multi-purpose cash. Again, it isn't meant to say that people can't follow additional indicators, but we wanted to have sort of a shared core minimum understanding of what people could and should be measuring. And additionally, as we know that there's a wider interest in cost efficiency and cost effectiveness and value for money, particularly in the cash world. So this initiative is part of the greater cost efficiency and cost effectiveness workstream within the Grand Bargain, and we do see our work as being one contribution, because in order to have comparable cost effectiveness data, you need both sides of that coin. You need harmonized cost measurements and you need harmonized outcome indicators. So this work can be viewed as being separate and apart and standing alone from cost issues, or you can look at it as part of an integrated focus on cost effectiveness. I will now turn it over to Jose, who will share, as I said, some of the results of a brief survey that we put out last month for people who were using or not using the multi-purpose cash indicators, and to help us get some guidance again as we move into some months of reflection and possible adjustments. Over to you, Jose.
Okay, thank you, Laura, for this really good presentation. Yeah. So, well, as I mentioned in the introduction, as you mentioned now too, we launched a couple of weeks ago. We launched an online survey that we share with practitioners, with organizations, to get some feedback about the use and, as you said, about the non-use of the multipurpose cash outcome indicators. And I will present some of the feedback and some of the findings. In total, we got 23 answers, where around 57% of the respondents are currently using the MPC outcome indicators, including in the draft for testing document. In half the cases, those indicators are being used only in a specific MPC projects or programs, and in other half of the cases, they are being institutionalized at the organizational level. As a general perception, we got that more than 65% of the respondents agree or strongly agree that those indicators contribute to improving the monitoring of the outcomes of multipurpose cash programs, while they keep themselves neutral, disagree, or even strongly disagree in a couple of cases. As you see here in this quite big table, in reality, the indicator mostly used by the responder are the cross-sectoral one, especially the two more recommended, with 70% of the respondents using it, about household reporting to being able to meet the basic needs of their household according to their priorities, and the one that is measuring the percentage of beneficiaries reporting that humanitarian assistance is delivered in a safe, accessible, accountable, and participatory manner. They are also quite used the considered optional indicators related to the livelihood scoping strategies and the women empowerment indicator. Only few respondents are using cross-sectoral qualitative question as indicator, and there is also a bigger use of sectoral indicators from food security and the shelter sectors. Finally, there is also a higher use of indicators that are measuring recipients' economic capacity to meet essential needs. Following this survey, one important question that we asked was how the MPC outcome indicators could be better used or promoted. Some of the most relevant answers are included here in the slide. As you can see, some answers are highlighting the need of a wider dissemination of the MPC outcome indicators document at a field level through, for example, the cash working groups. Others highlight also the importance to have a better integration with already existing reporting systems at a cluster level, and also then donors that are adopting them too. Another respondent was highlighting that one step forward in the integration of the outcome indicators with donors was somehow the integration of the indicator done by FDA lately. There was also indicated the necessity to share evidences and findings on the indicator used, and in fact that's what we are trying to do also today. A couple of specific comments related to the need of including them in training materials, CALP training, and others, and also to the provision of already ready-to-use ODK surveys in multiple languages. There is also one critics related to ensure that all the indicators are smart enough. And finally, I suppose it could be considered also as a recommendation for the future, that there is the need of not changing the indicators too often, as it takes time to adopt monitoring system to new indicators, and if we change them, the monitoring system will be easily outdated. Finally, they were found, according to the survey, there were found some barriers to the use of those indicators in the short term, related mainly to the fact that organization has already its own MPC indicators. So the degree of institutionalization, something that we were analyzing before, of those indicators is in fact important, as well as it is still early to get to know about their use, as they are including them now. Some of the respondents or some of the organizations are including them now in the monitoring system, and will be assessing future intervention, in fact. Another comment was related to the need of getting direct feedback from other organizations that are currently using them. And that's, in fact, exactly what we want to do next. So now I will hand over to you, Dina, for the presentation of the first speaker. Okay.
Thanks, Jose. So we're moving now into the uses so far. And we have two field representatives that are going to be presenting on their experiences, what's good, what's bad so far, also that all in this process of learning. Next slide. So the first presenter is Emily Arnaud, who's representing CCD Colombia. She is actually a CashCap technical advisor. In the context of a scale-up of CVA programs in Colombia, she leads an M&E sub-working group aimed at consolidating and harmonizing M&E tools and practices, including baseline inline surveys, PDM questionnaires, and scorecards. She has key technical expertise in research and data collection methodologies, needs assessments, information analysis, and IDP profiling. So I'm going to be handing it over to Emily, and we'll have another presenter after this. We decided that in the interest of time and discussion, that we'll take all questions and discussions at the end. So please be, as Francesca already is, please be typing your questions into the chat box as we go so we don't lose them. And we'll come back to them at the end. So I'll hand over to Emily.
Hi, good morning, everyone. Can you hear me well?
Yep, great.
Yep, perfect.
Okay, great. So as mentioned, I'm going to quickly discuss some lessons learned on adapting the MPC outcome indicators to our local context here in Colombia. I'll try and be as brief as I can to leave plenty of time for questions afterwards. So please, next slide. One before, yeah, thank you. So a little bit about what we do first and our project. So as you know, the CCD is basically 15 NGOs worldwide that came together with a vision to deliver aid collaboratively. In Colombia, this is eight NGO members that are operating across 9 regions, maximizing different strengths of actors. So we have basically two consortiums that were set up in February 2019 and that submitted 2 harmonized proposals to UFTA in response to the Venezuelan migration crisis. And then ACTA joined in May 2019, and more are going to come in 2020. Sorry, I just had a small problem with my microphone. But just to say that the CCD, the way it describes itself is that it commits to delivering people-centric multipurpose cash at scale in a coordinated, adaptable, and harmonized and efficient way. And the main goal is to have improved impact for refugees, vulnerable migrants, and host communities. So that's the way it's going to present itself in the Global Refugee Forum on the 16th of December. Next slide. So now a little bit about the contextual realities that we work with here in Colombia, and that affects obviously the impact measurements. So an important thing to mention is that there are quite restrictive transfer values that we're allowed to give. I think it's about, now with the current rates, about $72 per household of 4. So when we talk about impact, this is very important because it'll limit the amount of change that you can see when we measure indicators. So it's obviously a highly mobile population. Here I put some data about regional figures, but it's basically, we used to have about 140,000 migrants and refugees in 2015, and there's now pretty much 5.5 million by the end of 2020. I think in Colombia, that's about 1.5 million migrants. So the situation is moving very quickly. One of the interesting things about our context is that it's very much at scale. So we're talking about 160,000 beneficiaries for these harmonized proposals that we talked about earlier over an 18-month period. And it's 7 organizations. And one of the very interesting thing about these organizations is that they're contracting the same data management system in order to have harmonized and standardized beneficiary informations and avoid duplicates. So in terms of M&E, we're going to have a very big sample size to look at when we're looking at impact. Another interesting aspect is that we have an M&E working group, which the CCD is co-leading with WFP, which works under the cash working group, and that works on harmonizing methodologies for baseline and endline, eligibility questionnaire, and other types of measurements. So we're able to work as a team with these different organizations. Next slide. Now about the indicators that we're choosing for this particular project. So as Laura knows, we came at an interesting time because we were in the middle of the piloting. So we had some flexibilities on which ones we were going to use and which ones of the previous indicators we were going to stick with. So in terms of the new sort of cross-cutting indicators that we will use, the ones that were mentioned before, we have the process one about percentage of beneficiaries reporting humanitarian assistance in a safe, accessible, accountable, and participatory manner. We have the basic needs indicator. So people who report being able to meet their basic needs according to their priorities. We have the livelihood coping strategy phases. And then we have sort of mix of indicators, some that are the ones before, but with simplified self-reported methodology, and some where we're still using sort of sphere standards and sectorial indicators. Next slide. So I don't have time to go into all the indicators, but I wanted to give you a little snapshot of one of the indicators and how we took the guidance and adapted it into our baseline survey. So for the basic needs indicator, as you know, so this is the phrasing of it. We had the percentage of households who were able to report being able to meet their basic needs according to their priorities. So it's very much self-reported. And the suggested language in the guidance is to use all, most, some, or none to get an idea. It should not try to define what basic needs are, but we can prompt using certain words. And it shouldn't mention the cash transfer or attempt to measure the contribution to the cash transfer. So this is what we took to our working group to try and come up with good questions. Now, just to give you a little bit of detail about the kind of feedback that we had. For our team, this was actually quite difficult because we had sectorial experts, which sort of struggle with the self-reporting aspect of it. And so if you could go to the next slide, I'll show you what we have now as questions. So we basically broke it down into two questions as suggestions. So we have, can your household satisfy all, some, or none of your basic needs as you describe them? And then we have a next question when people respond some, most, when they respond some, most, or none, what are the basic needs that your household cannot meet? And so here we just got the data in, so this is preliminary data, but it's just to give you an idea of what kind of data you can get from these questions. As we expected, most people respond some. It's quite rare that they respond other questions. So it's mostly some, 14% say none, 9 say most, and 4 say all. And then the main needs, the way that we do the questions is that because it's self-reported, we let them talk. And then the person doing the interview has sort of a checklist of needs, and then they just check according to what the person says. So here you can see that most people mention food, employment, accommodation, and then it's closely followed by health, and then further down, education and water. And then a lot of people mention other needs. Well, not a lot, actually. A few people then mention other needs. So other needs are things like diapers for children and different types of non-food items, usually. So just to mention that for us, it was a bit of a challenge to have this indicator because we were wondering, given the fact that we knew everyone would say some, a lot of people were saying, wait, why are we asking this? Why do we need to ask this? But then I think talking to the interviewers, they like the fact that it's holistic, and it's very much appreciated that people are left to speak. So that's some of the feedback we've had. The only issue is that a lot of times it's hard for them to know what basics needs are, and because it's self-reported, you can prompt them, but it creates a discussion. Then just to give you a few more baseline results for your interest. So we had the one about, does your household have access to essential hygiene products, such as soap, feminine hygiene items, and toilet paper? So here you can say that most people say yes, 32% say no. Do you have adequate and sufficient access to basic household items? So here we have 83% that say no, and 16% that say yes. Next slide, please. So a few insights and recommendations based on these indicators. So as I said, this shift to self-reported indicators is quite welcome. People like the fact that it's holistic because they feel that it's more in line with the project logic in terms of what we can achieve. But it can be difficult because we had a lot of sectorial experts around the table, and it's very difficult not to use the ones that have always been used and that are tested and proven. And it'll mean that we'll have less data, and so that's also a trade-off. Then another observation is that the guidance in the self-reporting section still refers to sphere for prompting. So this created debates in our team because it's always a debate of how far you should go into the questions. So we actually cut down the questions a lot, but we used to have a lot of questions, and then that's always a bit of a struggle. And then, as I said, we have a small transfer value. So we were all concerned that the impact would be small. So because these indicators are quite general, especially for shelter, for example. And then the recommendation. So in terms of how we work as a working group. And it takes time, obviously, because we try and build consensus and have everyone around the table. So that's one of the issues to consider. I think it's still very interesting, but it takes more time and investment. As Laura was mentioning, we very much found that there's trade-offs in terms of having household level questions. And it's important to focus on more qualitative questions as well. And one of the examples of this is with hygiene products for women, for example, or all the questions around our gender-specific issues, because a lot of the household members are males, so it'll be difficult for them to have that information, or maybe they won't feel comfortable about giving it. So more focus on qualitative questions, and the use of focus group discussions is welcome. Then we have a point about the use of household hunger scale and food consumption score. And try and compare these in the context of Latin America. And this is actually a point that was raised by Save the Children. I don't know if that's something they want to discuss, but this could be interesting. And then final points about further guidance on how to not just phrase, but also analyze the new self-reported indicators. So now we're at a stage where all of our M&E focal points are doing the analysis, and it's compared to the sectorial indicators, it's harder to say, okay, what does this actually mean? What conclusions do we draw from this? So these are all, I think these are all the recommendations that we can come to at this point, keeping in mind that it's still preliminary. So we're going to be tracking this very carefully, and we'll probably have more specific information in the months to come. So that's all for me. I leave it to the next presentation. Thank you very much.
Thanks, Emily. That was great, really insightful. It was really great to hear, honestly, how you guys have managed to incorporate a lot of these indicators and also some of the challenges that you're facing. So that was really helpful. Thank you. Now we're going to move to a presentation from Save the Children Peru. Next slide, please. This will be presented by Kundil Katak from Save the Children. She also is an M&E or a meal specialist. She's within the Department of Hunger and Livelihoods at Save the Children US. Here she provides meal support for USAID-funded humanitarian and development food security and livelihoods programs. And she holds a Master of Public Health from George Washington University. So Kundil is going to be talking about the experience in Peru, and we'll hand it over to Kundil. In the meantime, please be typing your questions in the chat box so we can be addressing them at the end of her presentation. Over to you, Kandil. Kandil, I think you're muted as we can't hear you.
Sorry about that. Can you hear me now?
Yes, great, thanks.
Okay, thank you. So I was just saying I'll be sharing a little bit about our experience in Peru on using the multipurpose cash outcome indicators. A little bit of a similar experience to Colombia, what we just heard about, but also some differences, and happy to share a little bit about that. And I provide sort of support from our HQ in the US. Our colleagues from Peru weren't able to join, unfortunately, but I will do my best to cover everything. Next slide, please. Just a little bit of background on the Venezuelan migration crisis. I'm sure a lot of people are familiar with it now. But to date, over 4 million, or as we saw now, 5 million people have been displaced. Nearly 300,000 of them are children. Peru and Colombia have been hosting the majority of these migrants, and as of June this year, Peru has accepted or has received close to 800,000 migrants. So quite a bit of the population kind of going further south into Peru and even further from there. Next slide, please. For our program, sorry, there's some like transition, so you'll have to just keep pressing enter. There you go. So our goal, or the approach that we use, is really providing emergency or immediate assistance to vulnerable and at-risk Venezuelan migrants coming into Peru and to cover their basic needs and promote their inclusion into the local economy and society in Peru. With our current program, we're targeting a little over 32,000 Venezuelans, prioritizing really women and children, pregnant and lactating women, persons with disabilities and chronic diseases, and elderly. We're operating in 5 regions: in Piura, in Lima, Lambayeque, La Libertad, and Arequipa. And this is sort of the route that we've been seeing among this very transient population, sort of starting up in the north, kind of coming through the border from Ecuador and making their way down. Majority of them have been settling in La Libertad and Lima because of the economic opportunities, at least what we're seeing so far. The sectors that we're covering, the main aspect of the program is multi-purpose cash assistance, and with a little bit of nutrition protection programming, and then we're doing some humanitarian coordination on the ground with other partners such as World Vision and CARE. Next slide, please. Next slide, thank you. So sort of our approach and why we chose multipurpose cash assistance, as mentioned in the previous presentation, this is quite a transient population, very mobile. So we're seeing sort of 2 distinct groups among the migrants coming in, transito or settlement. And so our approach is also a little bit different for each one, sort of addressing the main needs and the distinct needs of each group. We're based on our needs assessments, we've seen sort of that loss of purchasing power and households adopting negative coping strategies. And so, especially among children and women. And again, the goal of our program has really been to provide immediate assistance to help them meet their basic needs. And the highest levels of needs that we've identified have been food security, shelter, non-food items, hygiene, protection, and nutrition. So basically what our program is achieving or hoping to do. Next slide, please. So the 2 sort of packages, assistance packages that I mentioned, for the transit beneficiaries, it's really a one-off transfer per capita. And we're looking at covering that sort of the immediate costs of the duration of the travel for whether it's a household or the individual, which covers transportation, shelter, food, hygiene, and communication. So like a SIM card for the phone or a basic plan, and very, sort of basic accommodations, a lot of either hostels or shared sort of housing that's being provided, as we've seen a lot of people resorting to sleeping on the streets or in the bus stations where they arrive, based on that. And then for the settlement, these are the people that we're seeing who are settling in the bigger cities, planning on staying in Peru or in the given region or city for longer than a month. That's sort of the distinction that we've made internally, how we're defining what a transit beneficiary is versus a settlement. And for the settlement package, it's 2 months of multi-purpose cash assistance and then one sort of food top up for the most vulnerable of those households. Sorry, next slide. Yeah, thank you. Nope, previous. And we're looking at sort of this vulnerability score that we're assigning when we're doing our selection, during our selection process. These transfers are also based per capita, and the first month's transfer is the highest, so to cover those non-food item needs, when it's the basic sort of household items that we would typically expect households to sort of invest in as they're getting settled. And then the second month, it's a one-time sort of purchase, getting, like mattresses and bedding and kitchen items, things like that. And otherwise, the package is pretty similar to the transit, but this also includes consideration for hygiene and transportation. Next slide, please. So now I'll talk a little bit about the multipurpose cash outcome indicators that we decided to use. And as you'll notice, there are some asterisks, and those indicate that basically these particular indicators are also now included in the OFTA proposal guidance and the indicator list, and have their prospective peers. So I'll go through each indicator really quickly. Some of these, as was also mentioned in the sort of introduction, the food consumption score, reduced coping strategies index, are pretty, tried and true, and aligned with our donors, Food for Peace and OFTA. So we've included those. The basic needs one, similar to the previous presentation, we're sort of asking this quantitatively in our baseline, and actually all of these are included in our baseline, and they'll be measured again at final evaluation sometime in March. So I've given sort of examples of the questions that we've included in our baseline questionnaires for some of those indicators. So we have the basic needs, then we've adopted the shelter indicator. So really the indicator around meeting agreed technical and performance standards. So we've consulted our technical experts on the project, and really the question and how we've defined it is, do you live in a covered living space that provides thermal comfort, fresh air, protection from the elements, privacy, safety, and health? We've also adopted the access to non-food items. Based on the guidance provided, we've provided sort of examples, sort of prompting what this includes. So clothing, bedding, cooking supplies, things of that nature. Access to essential wash non-food items. This one, I've made a note that this was adopted from the earlier version of these indicators, so they're slightly different than the final list that came out in July. Same with the households reporting access to water. And again, we've just asked these with one simple question in the baseline. We did include the expenditures indicator, the total monthly distribution by category. And we will be including the indicator around whether humanitarian assistance is delivered in a safe, accessible, accountable manner at end line. as well as the percentage of women reporting shared decision-making on cash transfer use at Edline as well. Next slide, please. Oh, and just a quick note, our program has been operating for about 7 months. And as I mentioned, these indicators have been included in the baseline, and we're doing sort of a rolling baseline just based on the way the sort of migrants are coming in. And so our selection and registration process is ongoing. Now on the indicators that we decided not to include, many of these we saw overlap in the indicators we were already using, or we weren't working in certain sectors such as shelter and wash and livelihoods. And some of these around expenditures, which are optional, but also would be adding, more questions to an already lengthy baseline. And so kind of figuring out what, is the best use, and also how we would then use that data once we have it and for decision making. So for a few of those reasons, we decided not to go with the livelihood scoping strategy because it's similar to our CSI and is quite long. The qualitative indicators, we did not include those around how the cash is being used or how the cash is helping households purchase certain items or meet certain needs. Again, the shelter one, I mentioned the one that we use that aligns best with sort of our activities and our program. WASH, as I mentioned, we're not working in that sector. Same with education and health. And then I also mentioned the expenditures, which really would just be adding more time and length to our baseline. Okay. So here I'm going to just talk a little bit about the sort of preliminary results that we're seeing from the baseline. So this is the question around on the right, asking whether households are able to meet all, most, some, or none of the basic needs. And I'm not seeing percentages on here. So let me just pull up my presentation. So we're only seeing about 1% who reported, households that reported being able to meet all of their needs. 5% reported most, 10% none, and as the previous presentation, we saw that majority of the households are reporting being able to meet some of their needs, and we're seeing that at about 84%. And then sort of we're seeing the 4 additional questions around WASH NFIs, around access to water, shelter as sort of breakdown of these basic needs. So for each one, we're seeing a good amount of households, 66% being able to access water, and we think that also has a little bit to do with the context, where in Peru, tap water, it's available and it's not, it's potable. And then majority of the people opt for filtered anyway, and it's pretty standard practice. So we haven't done any follow-up on this, but sort of going off of the contextual assumption. Then as far as non-food items, we're only seeing about 59% of households being able to meet that, and even less, 49% having access to sort of proper shelter. And we see that in the context where a lot of people are sleeping either on the street or sort of informal shelters, or kind of renting rooms in houses. So very, very informal access to shelter. And then about 34% have access to non-food items or household items, which is also aligned with our assumption that people, as they're leaving their homes, they're bringing sort of the bare minimums and mostly legal documents, which is also why we've opted for a higher transfer amount for the first month. Next slide, please. A little bit on sort of what we're seeing with our CSI. So as you can see, about 81% of households are displaying characteristics that are consistent with IPC3, 4 and 5, so crisis, emergency, and famine. And that's reflected in the sort of each individual coping strategy that is being adopted by these households. We're seeing sort of the two most severe ones adults restricting their consumption for children, and households having to borrow food or rely on neighbors and friends for food. We're seeing across all 5 strategies really that more than 75%, more than 3/4 of the households are having to adopt that. Next slide, please. On the flip side, with FCS, we're seeing some interesting results where more than half of the households are showing an acceptable food consumption score. And I sort of pulled out 3 food groups that were sort of interesting, where in the Peruvian diet and sort of the urban context that we're operating in. We know that households have easy access to these supermarkets where everything is readily available. And we also know that the Peruvian diet is very high in meat, fish, and dairy products. And you can see that sort of reflected here in this bar chart. And on the other hand, we're not seeing as high of a consumption rate for vegetables. So again, it does speak to the dietary diversity of the households, but that doesn't necessarily mean households aren't having to still employ those coping strategies. Again, some of the food groups that I also pulled out are weighted heavily in the calculation for FCS. So I think it skews the results a little bit there, but it's really interesting to kind of see those comparisons between what we're seeing with RCSI and then with FCS. Next slide, please. So some insights and takeaways in as I mentioned, many of these, or actually all of these indicators that we did adopt were from the pre-final list that came out in July. So some of the guidelines around access to water, that indicator in particular caused some confusion for our team on the ground. There wasn't any explicit guidance on whether this included tap water or bottled water only. And depending on sort of the location and the region, water sources are different. So we kind of struggled with that a little bit in defining what the water source or access to clean drinking and cooking water meant. Each indicator was measured, as I previously stated, with sort of one quantitative question. So it was pretty minimal effort in the baseline, not including, of course, FCS and RCSI, since they have sort of their own standard modules. And sort of takeaways or recommendations you would have is for USAID and cash partners to continue inviting implementing partners to provide input on these indicators and the development of the indicator itself and the peers. And as this webinar sort of reflects feedback, that we were able to provide sort of the post-testing and pilot phase. And sort of considerations that we think for are sort of key for implementing partners on the ground is, of course, the context, seeing what's sort of culturally appropriate, but also feasible in the context that we're working in. Tool development, so a lot of it had to do with before we had the peers and before the final guidance came out, sort of how we're asking these questions, because the formulation of the question really determines the outcome, and is it really capturing the essence of the indicator, if it's a single quantitative indicator, question, or are we adding on or supplementing it with qualitative without, again, making the questionnaire too long, and being able to use that data. The appropriate data collection method and frequency. So as I mentioned, we've been collecting or measuring these indicators only at baseline because that's the most feasible and where we would really be able to kind of see the outcome at final evaluation. We considered doing them during post-distribution monitoring, but again, we have so many process indicators already that are required by the donor, that it would just add more time and more length, and it didn't seem feasible. And would we, again, depending on the context, would we want to consider any sort of supplemental surveys or the focus groups to look at more of those qualitative indicators. And lastly, enumerator training. This was something that, of course, our team was not only new to the project, but also to our organization, Save the Children. So really making sure that we're providing adequate training to the enumerators, so they have a proper understanding of the indicators, what is being measured, how it's being measured, why, and where they need to sort of prompt. But also, again, these are self-reported, as was also previously mentioned, so just kind of balancing that a little bit of not skewing the answers. And that is all. Thank you.
Thank you so much, Kunjal. That was really great. So we have two really good examples, I think, of some initial lessons, both positive and some challenges. We'll jump into the questions and discussion. So as you're thinking, please feel free to continue to type questions as they come. I wanted to start, before we get to the specific questions from the two presentations, just clarity. Francesca was asking just for clarity on the survey. She was noting, so maybe this is for Jose and Laura. She was noting that there was sort of a low percentage of uptake or trial of the WASH indicators. I was just curious if we had information about who and what types of projects were responding to that survey. Can one of you take that one?
Yeah.
Can you hear me? Oh. Sorry, hello?
Yep, go ahead, Laura.
Sorry. No, unfortunately, we did not ask people to, people did not even technically have to self-identify to answer the survey. So we put it out broadly to the CaLP distro list as well as to the Grand Bargain Cash Group. But we don't have a lot of information about, sort of what sorts of sectors people were working on for their programs. So I guess one could make assumptions about why indicators are being used but not being used, but we wouldn't have that data to back that up, unfortunately. Sorry.
Yeah, that might be something we can do for the next survey leading up to the Grand Bargain, though. So that's a good point to take away, is to see if there's any patterns we can tell about those indicators that are being used or aren't being used. Okay, so moving on to some of the presentation questions. There's a couple of questions for you, Emily, about Colombia. The first few were not specific to the indicators, but seem to be still relevant, just speaking about indicators in general, around the coordination. It looks like Charlie had answered those, but maybe between you and Charlie, you could respond to these. So the first one is from Zedek. How is this experience of Colombia coordinated with the Cash Working Group? And also sharing data among organizations, how does that ensure compliance with GDPR? So Emily, either you or Charlie, if you want to respond to that.
I can answer the one. I can leave Charlie to answer the one about data sharing. I can answer the one about how it's articulated within the Cash Working Group. So from the CCD, when we came in, we were very keen on not duplicating coordination structures, so that what we do serves the response as a whole. So the approach we had was to have the M&E working group with the different members that are working on the outcome indicators sit under the Cash Working Group. So this is how it works in terms of the articulation with the Cash Working Group. So the sort of conclusions we reach, the insights, and the tools we share with the wider community. I don't know if that answers your question. And then I'll let Charlie answer the one about data sharing. I don't know if he's there.
Are you still there?
Otherwise, for GDPR, I can say that it is GDPR compliant. And we have, can you repeat the exact question about data sharing?
Yeah, it was just about how to ensure, hold on, let me find it. Just sharing data among organizations. How does that ensure, how can you ensure compliance with GDPR if you're sharing data?
Yeah. So in terms of the project that we have, there's two harmonized proposals with the same data collection methodology, and they've decided to use the same platform. So it was a major achievement because they're going to be using the same service provider, and although there are strict rules of who gets to see what aspect of which data on the platform, it is made to be able to share data among each other. And we're going to have a lot more discussions around that and specific webinars and findings around it. So I would encourage everyone to follow that too.
Great. Another question for you, Emily, from Nick. I think this is in response to the slide that you showed that like 40% of people were responding that they still had food needs and the high shelter needs. What percentage of household needs is the Colombia transfer supposed to cover?
Right, so I don't have the actual percentage, but just to note that, as I said, the maximum transfer value is about $87, I think. It's 250,000 pesos for a household of 4 and plus. And keeping in mind that we had an MEB exercise done, and from that MEB, for a household of 4, it would be about more than $300. So it's actually quite small compared to the MEB. I think it would be about 25%. So it's obviously quite restricted.
And I guess a follow-up question from me, I really liked how you guys had the follow-up question of what needs were you not able to meet. From what you've seen so far, do you think this indicator can, or how do you think it can lead to sort of programmatic decision making on the fly? Meaning, you know, if you continue to get that 40% of people aren't being able to meet their food needs, is that useful information for your programming team so that you can make adjustments?
I think for us, we're seeing very high numbers that are mentioning shelter, and it's an assumption that we had, but it just confirms it. So it's interesting for that. Then we need to think a little bit about how we phrase and how we word this indicator, because as I said, for now we let the people talk, and then we sort of depending on what they say, we have a checklist. But obviously basic needs are understood differently from the perspective of the people that are being interviewed, and so it'll be interesting to think about what we can actually get from that information. And as I said, although now we have this new indicator, there isn't so much guidance on the analysis of it. So I think we'll have to think a bit more about that in the future. But for sure, interesting data about, for example, shelter.
And a follow-up question from Nick about the consortium and the CCD approach. How do you balance the need to harmonize joint approaches within a consortium and the need to not slow down the implementation process while negotiating a joint approach?
Right, that's a very good question, and I actually had that in the last slide as a learning. I think that working together, we definitely took more time than it would have taken to do this individually. We'll have to think carefully once we get the results, once we analyze the methodology to see the trade-off. But as a whole, I think it's a very good practice because we have more data. And in terms of not just answering programmatic needs, but having the data to do, for example, sort of data inform advocacy and having joint messages, it's really, really important. So I don't have an exact answer, but it's definitely a very good question to keep in mind for the future.
And one more question for you, Emily, from Vincent. And if you're online, Vincent, you might want to clarify. I'm not quite sure I capture this. Did you consider the fact that some people can meet their basic needs with external support? So I hope you asked without external support. I think this is about the basic needs question and how you answered that, how you asked that question.
Good question. So you saw the wording that we had for the basic needs indicator. We have another question about what support they're getting from who, and then this type of thing. It's not directly linked to the basic needs indicator, just like it's not directly linked to the other sort of indicators. But yeah, we haven't asked it in that way. I don't know if Peru has, but it could be interesting if we rewrote it. Just to keep in mind that it's already difficult to get to the basic needs bit. So I don't know if it would really change the results. But yeah, something to keep in mind.
This is Laura. If I can also.
Yeah, go ahead, Laura.
Oh, sorry. Sorry. Just to add a little bit on that is that asking, putting a reference to external support is not part of the question, as it was developed in the outcome indicators document by the workstreams reference group, nor do we have it as part of our reference sheet when we're suggesting questions, in part because, although of course we can't get to attribution and people do have other sources of assistance, the hope/expectation is that between baseline and headline that you would see some improvement along those lines, you know, that you would have fewer people responding none and more people responding most or all, and that in part would be due to the cash transfer, which is of course external assistance. So, you know, obviously it's, you know, we're not getting to perfect data collection, but I think it would just be asking a different question if we were asking about it without external support, and I don't necessarily think that that's what the reference group was going towards. Over.
Kundil, do you have any comments on that, on how you asked the basic needs question? Any lessons learned from that so far?
I think, I mean, one of the things that we've been sort of thinking about internally is, again, how are we using that, or what is it telling us? Because as I mentioned, we've really been just asking it with one question of, is your household able to meet, or, you know, almost none, some of the basic needs. And I think in the next round, we'll probably kind of think through that a little bit more. And I like that idea of having sort of that follow-up qualitative question of which needs aren't being met. And I think sort of what was just discussed, if we see indication of if it's the needs that we're aiming to meet with our cash assistance, then that's something that we would, you know, need to rethink in our design or how the cash is being used. But otherwise, yeah, we haven't thought too much about it.
Okay, yeah, so it sounds like there's some good some promising practices, but still some to learn about that question. But I really like what you said, Emily, that it enabled you to see that there were certain needs that were not yet being met. So I think that's really interesting to use that as an indicator to be able to see over time how well your project is doing and if you need to adjust it. The next question I think is for maybe everyone. So Emily and Kundil, if you could both think about this, and then if others who have tried this could also chime in. How did you manage the balance between the basic needs indicators? Emily, you were referring to this, and having sectoral experts that were sort of challenging this mindset of the basic needs. Could you speak to that a little bit, Emily? And then maybe Kundil, you could reflect on it.
Sure. So the way that we worked, at least in most of the meetings, is that we invited sectoral experts to the baseline related discussions, and then we, among the 7 organizations, we allocated one indicator to one sort of sectoral experts. So, for example, we had a very knowledgeable shelter expert from NRC, so he would be the one coming up with the shelter ones, and in relation to the ones that he knew from sectoral discussions that he would have with the clusters or things like that. It was definitely difficult. There were big debates, endless debates, and we shrunk the original questionnaire quite a bit, as Laura might remember. Yeah, I don't know if we came up with a good way to do it, because everyone will have had their opinions, and it was definitely a negotiation. So there was some people had to give up on some of their working methods to have that holistic aspect. But I think for us, the main thing was knowing that, our transfer value is so low that we can't go on and ask such detailed questions to the people that we'll interview, because it just doesn't make sense. And a holistic approach is actually much easier in many ways, and much more appreciated by field staff. But yeah, it's still a trade-off. I'm not sure if we can say confidently that we found the way. We'll have to monitor carefully in the future.
Neil, do you have any reflections on that? Did you guys have similar challenges when you were working through these indicators?
Yeah, I would say definitely very similar experience in that. And I think sort of the agreements that we came to were around when we were really formulating the questions of including it in the baseline of how we wanted to ask it, and sort of those prompts, the examples that we wanted to include, if they weren't, clearly sort of defined in the sort of draft guidance for these indicators. So it was a very much similar sort of collaborative process, but a little bit challenging. And are we really capturing, again, the essence of the indicator? What is it that we want to know? And then sort of trying to really align it with our design and what we're considering the basic needs, and what we're aiming, again, to cover or help these migrants cover with the cash transfer.
Great, thank you. Kunil, the next question is also for you. It was indicated that nutrition was one of the objectives of the response. This is from Christophe. This is from Christophe. But we don't see any indicator on nutrition. Do you have any comments on that? And maybe Laura, actually, if you want to chime in afterwards with a little bit of background on the absence of nutrition indicators in this set also.
Yes, so I'll quickly jump in. So we do have nutrition indicators that are required by the donor, but not from the NPC list. And again, we adopted the indicators from the pre-final list, or what I'm calling it, before the one that came out in July. So, but we do we're measuring exclusive breastfeeding and also dietary diversity of children. I think under age 2.
Okay, so you're measuring them just not through this, just outside of these outcome indicators. Yeah,
exactly.
Laura, do you want to add a little bit of background on the nutrition component and why they're not part of these indicators?
Yeah, so that did come up in our original discussions with the reference group, as well as at the first stage, as I said, when we sort of had an open call for potential indicators. And there were a couple on nutrition, and there has been quite a bit of evidence focused around sort of in general the role of cash and nutrition. However, it was not typically found that multi-purpose cash in an emergency setting usually had nutrition as a main objective, that typically multi-purpose cash was meant to meet the needs in the MEB. Obviously, we're not saying that those can't have nutritional outcomes, they certainly could, but that since nutritional outcomes tended to be quite complex and diverse, are we talking about, Kandil mentioned, are we trying to promote breastfeeding or look at dietary diversity? Are we treating acute malnutrition? It did not, there really just was not a strong consensus from the field and from the group at the time, such that we could really have any recommended in there. As it says in the document, sort of this might change as things grow. However, we just put in a suggestion to reach out to the nutrition cluster if something was specific to a particular program, but there really wasn't anything that could rise to the level of kind of across the board, as we said, sort of a shared core group of indicators.
Yeah, thanks for that. There's a couple now questions about, well, we only sort of have answers to be honest, from the food security cluster around, and we've actually heard similar questions echoed from the shelter cluster. So I imagine this is something that is an issue for different clusters, and this may require further discussion. but I'm going to put them out. I think this is for Laura, Jose, and I actually, but if there's other people online that have thoughts on this, we'd really appreciate it. So the first one is, so these are questions coming from the Food Security Cluster meeting, which was now, I think, 2 weeks ago in Rome. The first one is, who is responsible to measure and report against the required outcome indicators? And secondly, how to make sure similar sample sizes would be used for measuring across the different sector-specific indicators. And who is responsible to make sure they match across sectors. So these two questions are more about how these indicators would be used within the cluster system and within the current cash coordination within each country and the reporting out within each country. Laura or Jose, do either of you have any initial comments on that? Or I also want to open this one up out to other people too. Yeah, go ahead, Laura.
So I can start. As we mentioned, USAID OFTA has, as of early October, the beginning of our fiscal year, we have adopted these as required. So in terms of sort of who is responsible for measuring and reporting, we are hoping that sort of by being a major donor going forward and making these part of our required indicators, that can help to mainstream it into quite a lot of different programs. And I think other donors will perhaps follow suit, which would be fantastic. We do hear at the cash working group level that there are several cash working groups who have been taking this forward. And I personally think that that's quite exciting. I know, at least in Nigeria, that they've looked at it, in Cameroon that they've looked at it. And then, as Emily mentioned, that CCD in Colombia is very much intertwined with the Colombia Cash Working Group. So I don't know if the working group as a whole is adopting any of these indicators. Maybe I'll put that as a question for Emily when we're done. But I think that is still a little bit of an open question, and you'll see sort of back with the survey results that Jose presented, where it was proposed that mainstreaming these within working groups within the humanitarian architecture would be a powerful way to help promote them and improve their use as well as their usefulness. But that's not, we were a multidisciplinary group within the cash workstream, so that's not something that we sort of have the power to focus on. In terms of sample size, that isn't something that we have explicitly gone towards. We did provide some general sample size guidance, just in terms of ensuring that there was an appropriate confidence interval. However, I think practically speaking, that would really have to be down to the implementing agencies. It's hard to envision how else to address that. Finally, Alice, you asked a question on the percentage of women who are reporting shared decision making. There was definitely a lot of discussion about that, about what would an appropriate gender-related indicator be. Should it be focused on outcomes from the cash? Should it be focused on decisions about the cash? This was what was settled on, although you'll note that we made it optional. I would certainly agree that targets really ought to be contextually driven, because of course what appropriate movement would really depend on the baseline, and certainly I would expect that would vary considerably by context, but that is just my opinion, so I will leave that there. Jose, I don't know if you have more to add, or Dina, if you wanted to stick on an implementer hat from your facilitator hat over.
Yeah, well, just to say, I guess, I actually brought this up with the first part of your question, Alice, around who reports and within the cluster system. I brought this to a colleague at OCHA last week. As we all know, the question of like cash coordination and measurement is not, there's no dictate yet from the global level. So the recommendation was at present that those discussions should be happening at the field level. And what's important is to make sure that wherever the reporting is happening within what cluster or cash working group, that at least there's a feedback loop that's going back. So for example, if the cash working group is reporting on the MPCA indicators, that the shelter cluster or the food security cluster make sure that they have that information if it's relevant to their sector, or vice versa if it's being reported out through the clusters. So for now, that was what OCHA was saying, recognizing that it is still a gap, sort of bigger than these indicators themselves, right? But sort of a bigger gap in coordination writ large, I suppose. A couple other questions. These are really good questions. Keep them coming. We have a few more minutes, so I hope we can get to at least a few of them. There is one question on food security, which we did have this discussion. So the question is whether there is experience piloting these indicators in context of extreme food insecurity like South Sudan, Horn of Africa. And a question about the household hunger scale as a recommended outcome indicator was discussed, as well as FCS. As household hunger scale is often an indicator, you know, it can tell extremes of food insecurity. Laura, actually, do you want to take that discussion?
Sure, in terms of the food security and the nutrition, or both?
Yeah, so the question is, was there a discussion about including both household hunger scale
Yes, yes.
as well as FCS and RCSI?
Yes, so there was. We were trying to keep it fairly short in terms of each sector. You'll notice that each sector sort of only has one or two, or in some instances three, because, as we said, we didn't want to make this overly heavy. We knew that, realistically speaking, implementers aren't going to be able to measure, 3 indicators per sector for 3 or 4 or even 5 sectors, in addition to all of the cross-cutting indicators. So the decision was made to try and keep things fairly focused. The food security indicators actually had more or less the least amount of sort of heated debate. Perhaps I'm thinking because, again, multipurpose cash coming so much out of the food security world, there was pretty strong consensus that food consumption score should come first, and then RCSI would be a very much appreciated second indicator. Household hunger scale was seen as important and useful, but again, just in the interest of having more agencies and more data focused on fewer indicators rather than including more potential indicators, but then having fewer agencies reporting on any one of those in particular, since the requirement, such as it is, was to have one indicator from each of 3 most relevant sectors for that context. Certainly, if there were agencies who wanted to look at household hunger scale in particular focuses where food insecurity is quite severe, certainly I think that would be recommended and useful, but again, just trying to find something of a core minimum consensus and the trade-offs between everything that fits into multipurpose cash, trying to have a broader coverage and then accepting a little bit of a lack of depth there. Should I cover as well the question from Murette about child protection?
Yes, please do.
Okay, so with that one, that was as well a live discussion, quite something actually that had quite a lot of debate, excuse me, within our reference group. At the time as we were coming up with our consultation draft, which was in March, the Cash and Child Protection Task Force was currently undergoing several pieces of work, the first of which came out in mid-2019, and then I believe that they were expecting the next one to come out around the end of this year, to look at M&E frameworks around multipurpose cash, as well as developing and piloting certain indicators that could be used to integrate child protection in multipurpose cash. However, because there wasn't anything at the time, we didn't wish to include any specific indicators. So instead, if you go to that indicator document, the tinyurl.com/MPC indicators, we have a note about their work and an encouragement to follow what they're working on. So I would say, pending the results of what comes out of that, we're certainly open to further conversations. It might be something more along a sort of mainstreaming safeguarding approach, such as we have now with the process indicator, or I don't know, honestly. I'm open to the potential that it could be for something else that would make sense, again, looking at sort of a core minimum. But since they were in the midst of going through a deep piece of work, it didn't make sense for us as a reference group to try and come up with something that would be, by definition, not as well researched. Over.
Yeah, thanks, Laura. So we have about 4 minutes. I'm hoping we can get to 2 more questions, but we might just get to this one. There's a question about debt that I think is interesting. But first, let's go to Roger's question here. So this is for Emily and Kundil. It seems like if these indicators are seen by the field teams as heavy, would flexible cash be labeled under a sector instead? So might this challenge increased uptake of MPC if the indicators are seen to be heavy, or is being taken up under some of the sectors? Do either of you have any thoughts on that?
So which sector would that be?
I think, Roger, are you on the line?
Hi, can I jump in?
Yeah, please do.
Yeah, so I don't know, I guess I have a hunch that when teams are designing programs, they have to sort of make decisions about what they feel they are able to achieve. And if they rightly or wrongly get the idea that these indicators are going to be very heavy for them to collect, might they lean towards explaining their programs in terms of a single sector that happens to cater for some other needs as well, rather than into full description of multipurpose cash and getting behind the logic? That's my worry.
I mean, in terms of our project, a bit hard to answer as such, but we definitely, when we explain what we measure, because there are some sectors that we don't measure, we focus on the fact that it's a socioeconomic survey, and that there's only a range of questions that we can ask, and the ones that we don't ask, for example, we don't have questions on education, but I don't know about having it sector specific. I don't know if Peru has more information on that.
Hi, this is Simon from IRC. I just want to say, if your program teams are making their decisions about how to frame and describe the outcomes of their cash programming based on how long the resulting survey tools are going to be, then I think that's a problem of the program design process, as opposed to necessarily these requirements being super heavy. One question I had in general for the practitioners was how long the surveys involving these indicators took per respondent to implement, because at least from our prior experience, it's like 5 or 10 minutes per respondent, if that. So I definitely understand the concern, but I think, yeah, certainly if people were making decisions on that basis, there's a bigger problem than the M&E requirements.
I smile and I agree with you, but it's encouraging that it really is only 5 or 10 minutes, if that's the case. Thank you.
Hi, this is Kundil. I can jump in and sort of speak to that a little bit. So that's really, I did mention that, but I mean, there are other factors too, but the reason I brought up sort of that adding more time is currently our baseline takes about 15 to 20 minutes per respondent. 15 if the family does not have children under 2. As I mentioned, we do have a nutrition component, so we are measuring the exclusive breastfeeding and dietary diversity of children, and those questionnaires are quite long. And so that adds about an additional 5 minutes for those particular households. So I think if you look at just these indicators, or if we're capturing them with just one question, and whether it's the baseline or PDM, whatever it may be, it may not seem like it would take more than, as you're mentioning, 5 to 10 minutes. But when you're looking at all the other requirements of the project, our project is funded by USAID, by Food for Peace and OFDA, and there are other requirements that we have, that indicators that we have to capture, and then for our nutrition and protection sector, the activities that we have. So if we're looking at just, for instance, these cross-sectoral indicators, the cross-setting or the sectoral, it may not seem like they would be that heavy, but as we start to add more and more on, it does get quite long. And then again, we're looking at sort of the context that we're in, these households having to sort of come to us to these registration points. Since a lot of them are mobile, we're not really able to go to them. And so there's a lot of different factors that we've had to take into consideration, but just again, based on the current length of our baseline, we wanted to be mindful of that. And so we limited to sort of including just the most pertinent indicators. And again, if we're not covering certain sectors in our design, it wouldn't make sense to, for instance, ask about health or education or WASH. So I'll kind of stop there, but just to give you a little bit of background of why we brought in sort of the timing.
Thanks, Kundil. I'm cognizant of time, as we're just at time right now, a minute over. Thanks for all of to the presenters. This was really useful as a launching point for others to be engaging with these indicators, and also to start to have these discussions around some of the sticking points that we've made different decisions about what to include and what not to include, and the usefulness of these indicators going forward. So if you have remaining questions, I know we didn't get to all of them, but this was a really great discussion. You can see our emails there, and we can also pass on any of those questions that are related to the practitioners to some of either Kundil or Emily. So a special thanks to Save the Children Peru and CCD Colombia, also to Jose and Laura for joining, and to all of you, thanks so much.